Well, I love abdominoplasties or tummy tucks because they are so transformative for patients. They're especially great for patients who have gone through pregnancy and have had babies or have had massive weight loss. The main goal of an abdominoplasty is to remove the excess lower abdominal fat and skin to help give you a new contour and a fresh new look. A drainless abdominoplasty is the use of something called progressive tensioning sutures. The main goal is to help eliminate dead space so that way there isn't an area for fluid to accumulate. This is much more comfortable for patients to recover then after having a tummy tuck. Drains can be really pesky for patients after having surgery. They can be a hassle and they can be tugging and pulling on patients after surgery. If you choose to have a drainless procedure, it is just another way of helping to decrease fluid formation, but it helps take tension off the scar and also allows for more shaping during the procedure as well. An abdominoplasty is a type of procedure that combines liposuction and skin excision. Complete liposuction of the upper abdomen and also pair it with resection of the lower abdominal skin and fat. This helps to provide a great contour for the patient. In addition, we also do plication of the rectus abdominis muscles to help give a nice cinched-in appearance to the waist. Drainless abdominoplasties can be combined with other procedures. Most commonly, we tend to combine a drainless abdominoplasty with back liposuction as well to really help achieve a great hourglass figure. In addition, we can also combine this with other procedures sometimes, such as a breast augmentation, a breast lift, a breast reduction, and other types of liposuction. A mommy makeover is a great procedure for women who have had children and want to rejuvenate their bodies. A mommy makeover can mean many things, but in general, it is some sort of breast procedure combined with some type of abdomen procedure. And so types of breast procedures can include breast augmentation, an augmentation with a lift, just a lift, a breast reduction, any of those types of things depending on your body and your needs. In terms of the types of abdominal procedures, it can be paired with any type of abdominoplasty. Usually most women require a standard type of abdominoplasty, or it can be paired with liposuction alone of the abdomen. There are several types of abdominoplasties, and each one is tailored to different types of body types. That's one reason why we love patients to come in, and so we can tailor it to your needs. So the first type of abdominoplasty is a mini abdominoplasty for some of our smaller patients. The next one is a standard abdominoplasty that has a somewhat longer scar. For patients that have excess fat and skin that comes towards their hips, we would use an extended abdominoplasty. And then the biggest type of abdominoplasty is for a circumferential abdominoplasty that helps to attack some of that extra fat and skin at the flanks and back. One of the more challenging parts of surgery can be a belly button, and many patients come to us very concerned if they will have a nice looking belly button afterwards or not. Sometimes one of the biggest tells that patients have had a tummy tuck is a poorly done belly button. So my goal is to help give you a nice and hidden belly button by hiding the scar nice and deep so it's difficult to see. In addition, I want it to look nice and natural by having some natural hooding and some inferior retraction as well to it so no one can tell that you had that tummy tuck. Erectus diastasis is a normal spreading of the abdominal muscles that occurs after women have had babies or sometimes also after weight loss as well. And so during an abdominoplasty, we work to bring these muscles back together by suturing them together, and this helps to create a nice internal corset effect or a nice cinched waist for patients. Exparel is a type of product that allows for better pain control. It's a liposomal bupivacaine, which allows for pain control for 3 to 5 days after surgery. During your surgery, we will inject it in for you, and that helps to decrease your pain after surgery. Recovery time is about 2 weeks for patients. We ask patients to take 2 weeks off of work if you have to go into the office. If you're able to work from home, we would recommend 1 week at home after surgery. We recommend that patients take 6 weeks off from activity and to go back to light activity after 6 weeks. It's 3 months before you have no activity restrictions. DVT prophylaxis is now considered to be an important and standard part of abdominoplasty procedures. In order to help prevent clots to the legs and to the lungs, we use several prophylactic techniques to decrease your risk of having complications. We use something called TED stockings. They're like compression stockings. Another thing we use is SCDs, or sequential compression devices. We also use something that's like a little breathing toy or an incentive spirometer. And we also use something called chemoprophylaxis, or a type of blood thinner such as Xarelto or Lovenox.